Welcome to Understanding Disease. Today we are focusing on Ebola, how it spreads, affects the body, and why prevention and early care are so important. Joining me are Ebola, who will explain things from the virus's perspective, and Dr. Jeer, an infectious disease expert. Thank you both for being here.
Thank you. I'm here to explain what happens in the virus's point of view.
Glad to be here. I'll help explain how Ebola affects the human body and why it's so serious.
So let's start at the very beginning. Ebola, how do you enter the human body?
I entered through direct contact with infected blood or bodily fluids like broken skin, mucous membranes, or contaminated needles. I don't spread through the air, so close contact is key.
While they kiss, the Ebola is transferred.
Exactly. This is why outbreaks often happen when people care for sick relatives or handle infected bodies without proper protection. The virus spreads easily if safety precautions aren't followed.
So once inside, where do you go and what do you do?
I target immune cells like macrophages and dendritic cells first. Then I spread to organs like the liver, spleen, and the cells lining blood vessels. I hijack the cells to make copies of myself, and when the cells burst, I spread even further.
This rapid replication explains why symptoms can escalate so quickly. The liver function is affected, which impacts blood clotting, blood vessel damage, and can cause internal bleeding, which is one reason the disease can be deadly.
Wow, so it's a combination of the virus's actions and the body's reaction, that causes the worst problems. Ebola, what symptoms do you cause in a house?
Early on, I caused fever, headache, muscle aches, and fatigue. As the infection progresses, I cause vomiting, diarrhea, abdominal pain, rash, and sometimes severe internal and external bleeding.
My stomach hurts so much right now. Oh.
Patients can also experience organ failure, low blood pressure, and other complications. Symptoms develop quickly, which is why early recognition and treatment are critical.
So the speed of infection is a huge factor in survival. Dr. Jeer, how does the immune system fight back against Ebola?
The body's first responders are macrophages, which try to engulf the virus, but Ebola can disable them. T cells destroy infected cells, and B cells produce antibodies to neutralize the virus. The virus slows communication between immune cells, letting it spread before the body can fully respond.
Exactly. If the immune system is too slow, I can replicate quickly and overwhelm the host.
So the outcome really depends on how quickly the immune system can react. So who usually wins the battle, the host or Ebola?
Sometimes I win, sometimes the host does. If the immune system responds effectively, the host survives and I am eliminated. If not, I can overwhelm vital organs.
Survivors often recover but can have long term effects fatigue, joint pain, vision problems, and the battle scars that remain even after the infection.
Well, I'm not sick anymore, but my joints hurt so much.
And what happens if a similar virus tries to affect the same hosts again?
Survivors usually develop antibodies that recognize Ebola. Reinfection is rare because the immune system responds quickly. Vaccines also provide additional protection.
Yes, after the host develops immunity, it's much harder for me to infect them again.
So are certain groups more at risk than others?
Yes, people in areas with active outbreaks, healthcare workers, family members caring for sick relatives, and anyone without protective equipment are at the highest risk. Children and the elderly often experience more severe symptoms.
Hmm. From my perspective, anyone who has close contact with the infected fluids is a target. That's why proper protection is so important.
So what about the history of Ebola?
The first recorded outbreak was in 1976 in Zaire, now the Democratic Republic of Congo and Sudan. Since then, there have been multiple outbreaks in Africa with high mortality rates. Awareness, infection control, and vaccines are crucial for limiting spread.
So, understanding geography and history helps explain why outbreaks happen and how to prevent them.
Exactly. My survival depends on poor protection and lack of awareness.
So, how can people prevent this infection today?
Use protective gear, avoid direct contact with infected fluids, follow safe burial practices, and get vaccinated if you're at risk. Awareness and hygiene are key.
Anything that blocks my entry or helps the immune system recognize me quickly and stops me from spreading.
Dr. Zier, what treatment options exist for Ebola?
Treatment is mainly supportive fluids, electrolytes, oxygen, and monitoring blood pressure. There are also experimental therapies and antibody treatments that improve survival. Hospital care can make the difference between life and death.
Yay!
Yes, if the host gets quick treatment, I'm much less likely to succeed.
So, thank you both for helping us understand Ebola. Dr. Zier, any final advice for the viewers?
Stay informed, follow public health guidance, and remember that prevention and early care save lives.
Now, Ebola?
Understanding how I operate helps people protect themselves.
Thank you. That's all for today's episode of Understanding Disease. Stay informed, stay safe, and thank you for watching.
Please, Miss Hamilton, give them a good grade. They deserve it.
Miss Hamilton, please give them a good grade.
Miss Hamilton, give them a good grade.
Miss Hamilton, give them a good grade.